Everybody, thank you for joining this lesson plan training call presentation today. This is on the Dental Assistant Module 1 lesson plans. As you can see here, we have 4 courses that will be teaching this mod. DA 303, which is Introduction to the Dental Team, DA 305, which is Skull Anatomy and Human Dentition, DA 306, which is Infection Control and Microbiology, and DA 301, which is Fundamentals of Dental Assisting. My name is Colleen Mee. I'm the Dental Assisting Program Chair at Ross, and I'm happy to be your host today during this presentation of the lesson plans. We will quickly go through these so that you become more familiarized with the topics that are presented this mod in order to prepare for teaching it. Now, as I scroll down, I want to mention that there are a number of pages at the beginning of each set of lesson plans that are designed to remind you of things that you need to do to prepare for your module start. Make sure you read through those so that you don't miss a beat. Some of them are repetitive. You might say, well, I read this last time, so I don't need to read it again. But they are good reminders for you. Sometimes it's very mod specific, so it may not be in every set of lesson plans. It might only be in mod 1. And if you didn't take the time to read them, then you've missed out on that. So always take a moment to flip through those first, say, 25 or 30 pages, how many ever there are, just to make sure it reminds you. And you might, oh, that's right, I forgot. While you're new, there's so many things that you're having to learn simultaneously. I always call it like, you're juggling a lot of balls in the air. And, it's so easy to drop one. And so use this as a means to ensure that you have what you need and that you feel prepared. Number one, of course, anytime you have a mod start and you get access to your course, you will need to prepare your course by putting in the due dates, creating the sections for your hybrid and your on-ground students, assigning those, and filling out the section in the course that says who you are. There's I don't know, they call it meet the teacher kind of a thing, where you will say, your name, you'll provide your email address, you'll give your office hours, and there's a place for you to say a little bit about yourself. And you can say where you went to college or where you went to dental assisting school. You might say my favorite procedure in dentistry is root canals. Some of you might not agree with that, right? Or dental implants. Or you might say, I worked in an oral surgeon's office for 5 years and I absolutely loved it. I mean, you can say something about your career if you want, but you may also say something about your personal life if you choose. Nobody's asking you to, but some of you have said, I don't mind saying, hey, I'm married, I have 2 children, and I have, a little fluffy dog named Joe. You feel free to personalize it if you want. Students, it makes you much more relatable. And although you are their teacher and you are not their friend, it does give them sort of a connection to you when they learn a little bit about you. So that's up to you. But in either event, make sure you have your course prepared, again, with due dates, your information, and so on. This page just reminds you that there will be core skills that you want to rehearse with your students, as well as the proficiencies for each module. Make sure you allow enough time each session to do some of both. And your lesson plans will give you, instructions on what will go on. All right, I'm going to skip down through all of this prep stuff here. Skippity doo dah. Keep in mind your hybrid students have all of the same assignments that your residential students do. They have the same rows, the same ICAs, and the same tests, but they do have an additional assignment called a discussion board. And this is to sort of take the place of the fact that your residential students get a live lecture. So they participate in discussion boards where they can interact with their teacher and fellow students. Other than that, everything else is identical. Your hybrid students will be graded by your hybrid teachers, and the residential students will be graded by the residential students almost exclusively. There are a few exceptions to the rule. If there's an assignment done in class, then that may be graded by the teacher, and we can discuss that if you have questions about that at another time. All right. Every module, new students, the first day, they will get PPE given to them. So you'll give them a paper gown and a face shield, have them label it, put it in their cubby, have them create a paper chart with their name, and they can fill out a fake medical history and a fake patient registration form. The only thing that needs to be on there that's real is their name. Everything else is, fake address, fake phone number, fake medical concerns. And they will use that anytime they do a procedure in the back with you. They will pull that chart and they will get opportunities to chart whatever it is they did. So let's say they were learning, they were sitting with you practicing a composite and you're the doctor, then you would say at the end of that procedure, okay, here's what I need you to chart. This was tooth number 8. We did a mesial incisal facial composite on tooth number 10, blah, 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 and then you anesthesia, the whole shebang, you tell them and they chart it. And then if time permits, you can send them to a Dentrix, to the computer, to put it into Dentrix even. But whether they're taking x-rays, whether they're taking impressions, they're taking vital signs, anytime they practice a lab procedure, have them pull their chart and they're to document that. Okay, this is just good dress rehearsal. The first day of every mod, you'll discuss dental anatomy, and you should practice that not only on day 1, but, actually throughout the mod. I try to find times at least once or twice a week to review tooth names, tooth numbers, tooth surfaces, midline, mesial, distal, all of that. So do that on day 1 and then periodically thereafter. You'll discuss hand washing and the importance of that, how to use their PPE. They'll watch the If Saliva Were Red movie to see how things are done, right versus wrong, and why that's so important. I'm going to scoot down through a lot of this because, again, there's a lot here, and you need to read it. I'm going to scoot. Always go over the grading guidelines on session 1. Remind students of how they are graded. Everything's on a 100% scale. Talk about what's considered on time and what's considered late. Row assignments must be submitted up until 11:59 p.m. If they're submitted at 2 in the morning, for example, then they're late and they get 10% off. ICAs are done the day of and they are due the day of. If they don't submit them, then they get a 0, but they may submit them later for 10% off. Any assignment may be submitted late for 10% off. Tests, go over the test policy, and on the test policy, we do have the 2 attempts in place, which means if they aren't happy with the score they received on their first test, then they may on a different day retake the test. They just cannot do it on the same day. There is always a final exam on session 19. The last day of the mod is session 20, so that would be, if they wanted to redo it, they'd have to do it again the very next day. But we do not let them do it the same day. We want them to go home and study and then, give it another shot. All right, so there's the test policy. Just remember to row assignments are homework. They are not to be done in class. There are assignments in your courses called critical thinking questions, and these are subjective in nature, and these are designed to get students to think on their feet. There is no answer key, but they do have requirements, and most of them will say provide a minimum of 4 to 5 sentences, or it'll say another amount. It might say, 6 sentences or 10 sentences. It just depends on what the question is, but make sure you always open up that assignment and read what the criteria is, and then that's really what you base your grading on, because we're trying to teach them to think on their feet. They have no real world experience. All they've learned about is what you've told them or what they've read in their book. So they may not have a good answer, for a what if. Like, what if this happens in the dental office? They might go, I have no idea. I mean, you told me about a couple things, but is that what you're supposed to do? So, sometimes their answers aren't completely right on target, but we do give them credit for a good attempt in thinking about it. If they don't provide a complete answer, then of course they're not going to get their 100%. I always say if there's a minimum of 4 to 5 sentences, a minimum of 4, that makes each one worth 25 points. So if they give me 1 sentence and it's on the topic, but one isn't very much, then they're going to get 25%. If they give me 2 sentences, they're going to get me 50. If they give me 3 sentences, they're going to give me 75. And if they give me all 4 minimum required, they're going to get their full 100%. And that's kind of how I handle that. Now, if the question's a dental related question and they talk about, their favorite movie, then obviously there's no points associated there. They might have given me 4 sentences on why The Wizard of Oz is their favorite movie, and that obviously there's nothing there to grade. That's just a 0. So it has to be related. But anyways, we do have some flexibility with that. So here's some notes for instructors. Make sure you read these. You'll see a lot of these are informations from one mod to the next that will look familiar, but it's always good to review them to refresh your mind until you get been teaching for a while, and then it all just becomes second nature. Okay. Some classroom management tips, which always is helpful with a new teacher. Okay, core skills review. Keep in mind that every day you have lab. There's 4.5 hours per session. And even on Mondays and Wednesdays, when you have lecture to do, there should still be time for lab, because we do not want those students sitting at their desk for 4.5 hours, right? So even if you have an hour and a half or 2 of lecture, that still gives them another 2.5 hours or so of lab. You can have some students practicing new skills while other students are practicing old skills. And I like to work in what I call activity stations. And so I might be at one chair with a couple of students learning the new skill. In the other chair, they might be reviewing a skill that was learned last mod. I might have some instruments on a desk that they have to identify at a third station. I might have the x-ray room open for them to practice x-rays, at least those that have learned how to take x-rays. I might have a computer pulled up that's not at their desk, where they have to go to and say schedule an appointment and update a health history on a patient in Dentrix. And these there's so many variables. These is just a few suggestions, but just to give you an idea. And then I like to incorporate the ICA as one of those, so that we know there's always at least one ICA per day. So instead of saying to your class, all right guys, here's time for your ICA, and then you just sit at your desk and wait for them for a half hour to finish it, you can make the ICA one of the rotation stations. So over the next 2.5 hours, say, or over the next 4.5 hours, depending on what day you're on, some might sit at their desk and start their ICAs, while others will be in the back doing the lab, and say then every 15 minutes they switch chairs. And that way everybody stays active and nobody gets bored, and they complete their ICA in all good time. So this is just a list of some suggestions. This is not an exclusive list. This is just a starter list, if you will, of some things that can be done for core skills. This also reminds you about your program assessment that you'll be doing with your seniors on the last day of the module. This is, some teachers actually extend it during the whole last week. It just depends on how much you have to accomplish, but this is where your seniors get another shot at practicing skills. It's kind of one more, like a dress rehearsal. It's one more time practicing before they go out to externship. You won't be doing all of the skills. You'll be kind of picking and choosing which ones are most appropriate for that student that they feel they need the most practice with, and that, you feel they need the most practice with. This is a whole topic in itself, and so I won't devote that to this lesson plan training, but this is something that you will do with your seniors every mod, and the results are recorded on a Google spreadsheet. So if you need more information about this and we have not talked about this yet, please reach out to me and we will schedule something to talk about program assessment. All right, pre-quizzing is something you can do. It's just a technique that teachers often use, where you ask about 10 pre-made questions about the chapter that you are going to lecture on that day. And this gives you an idea of where your students are at before you begin lecture, so you know where you need to deep dive in and other areas that you can kind of skim over because they seem to have a good handle on it. There are, in most cases, pre-made questions for you in the Evolve Instructor Resources website. If you click on the book and select Teach and go to their Teach lesson plans, which we don't use we have our own, we're looking at them right now, but they do have some great suggestions for the chapters. So let's say you're talking about chapter 1, you could choose the chapter 1 Teach lesson plans and kind of scroll down until you find the the chapter pretest, and you could use those quiz questions. Do you have to? No, absolutely not. It's just a suggestion. You could make up your own, but it is a great way to kick off class. All right, Ross Edge is where students practice and learn soft skills. They learn how to interview, how to create a resume, answer the phone, handle difficult patients. It's a really great website. Everybody needs to have a login for this. So day one is a great day to get everybody's login situated if they don't have it already. You can log in and kind of give them a quick tour of what it looks like. As a new teacher, if you haven't, you'll need to set up your own login for this and then familiarize yourself with it. Students will wear dosimeters anytime x-rays are being taken in the classroom. Teachers have to wear a dosimeter as well. If you have a pregnant student or pregnant teacher, they will wear two. They will wear their regular dosimeter at their neckline and what's called a fetal dose monitor at their waistline. Any new students will have a dosimeter ordered for them the first week of each new mod. So even if they haven't learned how to take x-rays yet, they still have to wear a dosimeter if x-rays are being taken in the classroom by, say, another student who has had the x-ray mod. There's a whole process for this. So again, I will not devote our time on this call or this training to this particular topic. If you have questions about it, please reach out to me. Seniors will get a second dosimeter ordered for them, their last mod, and they will take that brand new second dosimeter with them to their site. We keep the original on site. It never leaves the classroom until they graduate, and then we ship it off for processing. It's a pretty complicated process. It's not hard, but there's a lot of steps involved, so I'm happy to go over this with you. Just let me know. Okay, I'm gonna keep going here. Spin, spin, spin. This talks about live suction practice. Although COVID pandemic is over, we still practice heightened infection control measures. And so there are some things that we do for live suction practice that we don't use for mannequins, level 3 surgical masks, and some other things here I won't go into detail, but please make sure you've read this and that you're completely understanding what is expected of you anytime you offer live suction to your students to practice. Live suctioning is taught in Mod 3, but again, as a core skill, you may have students who are practicing this who've been through Mod 3, and you may have time to teach new students. Just depends on how much time you have in class. All right, we're going to keep going quickly down, down, down. Some other things to talk about on the first day of the mod, to talk about the test schedule, how important it is to prepare for a test so that they do well, go over their textbooks with them. Go over anatomy, tooth names, tooth numbers, define surfaces, midline, quadrants. Use your whiteboard, use your tooth models. You can use your mannequin. Some teachers will go back to the lab and they'll use an explorer and they will point to the teeth as they discuss them by name and by number. That's totally fine. More instructions here. New students will complete what's called the citation plagiarism training. This is a non-graded assignment. They will work on it while they're with you in class. They do not have to have it completed until I think session 15 or 16 it's due. So they have plenty of time to get that done. But because it's not graded, if they do it at home, they just probably won't. So that can be something they can work on while you're working with other students on something else. Students on day one will watch their BBP training, which is bloodborne pathogen. They will also watch their saliva is red training, and you'll go over that with them. On session 7, students will begin to use microscopes for a couple of days. If you don't have microscopes in your classroom, you'll need to reach out to your MA instructor to make arrangements to borrow them from him or her. Make sure you get some training on how to use them. You know, they are pretty high tech, and so if you're not familiar, don't be afraid to ask. Somebody on campus can show you how. Also, ahead of time, it's good to note that the choosemyplate.gov website is going to be used. Again, good to be there early, check it out so you know what you're talking about when you take your students there on session 13. They will be using that for a report. Another note specific to this mod, there is a spelling quiz and a spelling test. Okay, so one is an ICA grade and the spelling test is a test score. So very important that they know that, and you should remind them of it. because the tests are weighted heavier. And then there are 2 Dentrex assignments that have to be done on campus. Students do not have Dentrex on their laptops. So as they are learning Dentrex skills, they have to happen while you're in class. And Dentrex does fall under lab time. So when your hybrid students come to school on Tuesdays and Thursdays, working on Dentrex is a lab for them when the lesson plans call for that. If there is something that is being taught in Dentrex on an off day, then make sure you make a note to carry that forward and teach that to them on the day that they arrive so that they get the same training as your on-ground students. This talks about proficiency documentation. The proficiencies for this mod are oral hygiene instructions, how to use the BASS brushing technique, how to assist a patient with dental floss, hand washing, and how to use an alcohol rub. I also include in here how to floss a dental patient. So not just teaching them how to use floss themselves, but we often know doctor says after, say, a crown has been seated, they have you floss between the teeth to get the cement out. You might be a hygiene assistant and have to floss after the prophy paste. So we want them to know how to floss a patient too, is what my thinking on that. So not too many. This will give you lots of time to practice core skills in Mod 1. This is a nice mod for extras. All right, I'm gonna scoot down here. This is still session 1. More reminders. Okay. They will be learning about some prefixes and suffixes and also abbreviations used in dentistry. And these 2 appendix that are referred to here, Appendix C and D, these are found in their course. They are downloadable, they are printable, and you can review those with your students in class. Lecture is on chapter 1. It's the history of dentistry. And you can see it goes from the very ancient beginnings to the 21st century, and then into some National Museum, diversity and inclusion, gender diversity, so on. Chapter 2, the professional dental assistant, breaking down the differences between hygienist assistant, lab techs, and so on. And some professional organizations such as the American Dental Association, and so on. Okay, I'm going to keep going. Session 2. You talk about chapter 2, which is the dental assistant and part of the healthcare team, acting as a professional. What are the qualities? What are the characteristics? Dressing appropriately, talking appropriately, conducting ourselves in a professional manner. What are the differences in share-side assisting or circulating or say sterilization and so on? Administrative dental assisting. Talk about credentialing. What are the differences between the Danby Certified Dental Assistant and the Danby NELDA or NELDA credential, which, by the way, our students are immediately eligible to take the NELDA if they're interested. I would encourage you to go to the Danby website, danb.org, read up on the protocols and the ins and outs of those exams so that you are familiar with that, so you may discuss them with knowledge. Also discuss with them the American Medical Technology credential called the RDA. This is not an expanded function credential. It is just simply another national credential that they are eligible to sit for immediately, and it gives, they get to put that behind their name, RDA-AMT, and it shows the dentist employer that, they can walk the talk. They've passed an exam a rigorous exam, right? That they know what they're talking about. So we talk about and encourage credentialing here. Lots of information there about that. They're going to do some Ross Edge assignments on session 2. So they're going to go to that website. And then we go to session 3, and they're going to learn more specifically about the specialties, endo, oral surgery, pediatrics, and so on. What's the difference between a hygienist and an assistant? What's an expanded functions assistant? What's a circulating assistant? The differences there. And then we move from that into anatomy, and we start talking about general anatomy. And we start off with just the basics, like the differences between cells, tissues, organs, and body systems. And then we will be building on that on the following day. There is another Ross Edge assignment. Session 3, we'll be talking about the human body. Session 4, talking about physiology, so how the systems work. And this is a good day. These days are good days to borrow from the MA clinic. They have a lot of really cool, like anatomy models, where you could, that has the different organs and such. So you might ahead of time talk with your MA instructor to see what he or she has that you might be able to borrow for a day or two to have in your classroom. So as you were talking about these body systems, you can have some of these kind of cool, models on hand to help illustrate what it is you're talking about. All right, session 5 has to do with head and neck anatomy now. We're going to talk about the skull bones. Here's where you use your skull that you have. You pass it around, let students see it. If you have a labeling gun on campus, which you should, you can label the bones on the skull as they're learning them and then later peel them off. Please do not color your bones with Sharpie markers, different colors. Please do not write on the do not Sharpie, the names of the bones on the skull. I've seen this happen, and I've had teachers say, well, I wanted them to learn it, and so I color coded them or I labeled them permanently. It's like, let's not do that, okay? You can use a labeler and then peel them off afterwards. That way you can teach them where they're at and then peel them off and quiz them if that's better than destroying with a permanent marker. So, there are some really nice videos online too that teach skull bones, and a couple of them have been embedded into the course, but you might find some others that you want to use as well. They're also going to learn about the muscles of the head and neck, the parotid glands, the circulatory system of the head and neck, arteries and veins, nerves, lymph nodes, sinuses, and then the lips and the oral cavity proper and so on. Okay. Session 6 is prenatal development, basically oral embryology and histology here, how teeth are developed, developmental disturbances. Then we go into the dentition, primary, mixed, and permanent, tooth numbers, tooth names, quadrants, sextants, all the good stuff here. Another Ross Edge assignment. Session 6 continues here. Session 7, we move they take a test and they move into infection control and microbiology. And they start off in chapter 18 where they are learning about the pioneers, the earliest scientists that discovered a variety of the microbiology things that we need and we know about today. So I won't, this is, kind of interesting to some and not so much others. That John Lister, he's the one that developed Listerine. That's kind of always an interesting fun fact. They will be learning the microorganisms, so the differences between a bacteria, protozoa, fungi, virus, or rickettsia, and algae, and then some common, obviously this list is not, this is just an example list, but some viral diseases versus some bacterial diseases, which are listed here. And some more Ross Edge. We always have Ross Edge. Okay, and then we get to session 8. And here they are going to learn, they're going to use their glow germ kit that they have in their classroom. And this is kind of fun. If you haven't used this stuff before, there is this orange liquid that you can rub on your hands and then take them to the sink and they scrub their hands really good with soap and water, even like a nail brush. And then you turn the lights off and you shine the light over it and you can see on your hands where you missed. So it's quite eye-opening because you always feel as though you really scrubbed your hands well, and then you turn the light on it and you're like, oh my gosh. And all the areas kind of, it's like glow in the dark is what it does, glow in the dark paint kind of stuff. So it's kind of fun, but it's illustrative. It is hard to get off, so don't be too harsh on your students if they don't get it all scrubbed off. It's meant to be pretty tenacious, but it does prove a point. So it's very useful. There is a powder that you can sprinkle on things like the dental chair or the countertop and then have them wipe it down thoroughly and then use your black light after the lights are turned off to see how well they wiped off the surface. Again, the powder is fake germs basically, and it'll show up as glow in the dark. It's pretty hard to wipe off. So again, it's always an eye opener when we do this, but they often find it very interesting and fun, and it is a prequel to the hand washing proficiency. If you have the Discovery DVD disc on campus, you can show them a number 3 infection control methods. If you don't worry about it. This isn't something, these were provided to the campuses, years ago, and some have been are since gone, and we are not replacing them. So if you have it, great. If you don't worry about it. There's plenty of other illustrations in the book and videos and the lesson plans for that. So it's just an extra. But we are talking about the chain of infection here, how infection spreads, the immune system, and so on. And we're going to talk about PPE, how we wear it, how we put it on, take it off. And then we get to session 9. Keep going to, sorry, I'm still session 8 here. Wiping down surfaces using surface barriers, differences between various types of disinfecting solutions here. And then we'll get to session 9. There is a microbiology quiz, and then they go into chapter 20 and talking more about surface contamination and more on disinfection, housekeeping surfaces, and then we move from there into regulatory agencies and professional agencies, what they all do and what they, what they're responsible for. And then chemicals and how we handle those and what we need to do about that. And sharps disposal. All right, keep going here. Session 10, there's a test, and then we go into session or chapter 13, public oral health. We're going to talk about early preventative care, pregnancy care, care of the elderly. How do they keep their teeth clean? Toddlers 0 to 5. We talk about what fluoride is, how it's used, what are safe and toxic levels, and how it's applied. Keep in mind, we do not give each other fluoride treatments. Remember, we are not a practicing dental clinic. We do not have patients, nor do we have doctors. So nobody gets a fluoride treatment in your clinic. All right. You can role play, you can use your mannequin, but nobody gets the real deal in their mouth, please. Okay, that's just against the law, and gosh, imagine if something happened to somebody and they had an allergic reaction. So please do not let anybody apply any fluoride to themselves or somebody else. Some role-playing opportunities here that are discussed. Mid-mod advising is always on session 10. Session 11, we're going to talk about nutrition, the parts and pieces of nutrients, right? Carbs, proteins, fats, water, vitamins, minerals. Well, this is where they're going to go to the myplate.com website. They're going to learn about how to read a food label. These are things that once they've learned, they'll be able to share with their own patients when they are working in the field. Foods that cause decay, sugar substitutes, diet analysis, eating disorders, and some number of web activities here that you can participate in. Session 12, we move into the dental record. So risk management, the differences between a paper record and electronic record. What does a record consist of, right? Medical history, registration form, clinical exam form, treatment plan, informed consent, HIPAA documents, and so on. Okay, they're also going to learn about oral diagnosis and treatment planning. Not as dental assistants, we of course do not diagnose and treatment plan, but we assist the doctor in that. So they are going to learn about the ways the dentist will come to a decision by using their eyes, how to palpate, instrumentation, using x-rays and photography and so on to come to a conclusion and create a treatment plan. We will also be reviewing tooth numbering again here and treatment planning. Okay, session 13, we talk about chapter 9. This is where we get into HIPAA in more detail, filing methods, types of records for, say, accounts payable, accounts receivable, tax records, insurance information here, again, more on filing. And as I scoot forward to session 14, you'll see chapter 62. We're talking about business practices, a personnel manual, dental records, financial records, business records, OSHA compliance, HIPAA compliance, cybersecurity, appointment scheduling, guidelines for making appointments. Here's where we talk about, how long does it take to schedule, like you schedule for fillings or a root canal or a cleaning and that kind of thing. Also, scheduling for children, scheduling a recall, a new patient exam, circumstances, patients with, broken tooth and so on. Okay, I'm going to keep going here. Session 15 is where they will be practicing exclusively. I mean, the whole session pretty much is you're on Dentrix and you're scheduling appointments, and you're going to use what we call packet or set A. And there's, I don't know, 12, maybe 15 scenarios of fictitious patients for them to practice scheduling. And you can do it with them on the computer in on your cart. You can project your Dentrix right up onto the whiteboard and schedule these with them, and they can learn. The second set will be an ICA grade, so they will be doing that independently. But I do suggest that as a teacher, you look at the B packet and see if there are some things in there that they will need to be made aware of before they get that as an assignment, so that you can teach it to them on this session when you're going over how to schedule. All right, session 16, there's the spelling test. Then we're going to talk about inventory management, types of supplies, consumable versus non-consumable, major equipment, inventory management, rotating of supplies, when do we order, how much do we order, what is a back order, that kind of thing. And as we all know, doctors don't give us a credit card and say, just go buy what you want. You have to work within a budget. And so talking about the importance of managing that budget here is valuable. This is where they do packet B of their Dentrix. And then session 17 is where we talk about etiquette, answering the phone properly, taking a message properly, putting a caller on hold appropriately, working with those difficult callers, like the one that's angry about their bill, the one that demands to talk to the dentist, the one that demands that they get an appointment today, even though there's not an opening, or that emergency patient that we've got to find a spot somewhere and they're crying and they're in pain. Like all of these scenarios you can come up with and have opportunities for role playing here. This is a great chance for that. Then we go on to session 18, and here we are talking more about communication, how to handle conflict, how to hold a meeting, a staff meeting, and again, more opportunities for role playing. When we get to session 19, this is where they take their last test of the mod. And then there is a lot of anatomy review this day, and this is also a great day for core skills. They can practice a lot of things that were taught previously. Session 20 is where they will get a second attempt at that final test if they want one, but is also the day that we do senior scenarios or patient senior assessments for your seniors that are going out. So that's where you do your day in the office scenarios. Everybody participates. It's not just about the seniors, although they are the ones that get the assessment done, but everybody role plays together, and everybody can be practicing these skills. Some can be patients, some can be rovers, and some of them can actually just practice right behind the senior. So this is another conversation that takes more than 2 minutes to discuss, and so this is a great phone call conversation that you and I can have together when the time is right. You just let me know, and we will discuss this on one of our training phone calls. And that takes us to the end of the session, because there are 20 sessions in the mod. So with that being said, that wraps up what we had planned to discuss for today. I'm always here to answer your questions. Please never hesitate to reach out to me. My email address is cmee@rosseducation.edu. I'm only an email away, or you can chat me, or you can give me a call. My office phone is 313-960-4890. Easiest probably way is to email me, and then we can set up a time to talk. But I want you to know that I'm always here to help you should you have a question. That's my goal, is to make sure you are a successful instructor with us at Ross. So don't be afraid. Reach out if you need some help. All right. Thank you very much for your time today. I appreciate it. I will look forward to talking to you again soon when we discuss another mod together.